We've reported on this here at NewsNation extensively in recent weeks, and now the U.S. has officially labeled the zombie drug Tranq as an emerging threat. A veterinary tranquilizer called xylazine, meant for animals like cattle, often mixed with the powerful opioid fentanyl, and this dangerous drug combination producing devastating side effects. Among them ulcers, slowed breathing and heart rate, abscesses, and rotting skin. Here with us to talk more about the dangers of Tranq is Dr. Rahul Gupta, director of the White House Office of National Drug Control Policy. Dr. Gupta, thanks so much for being here.
Thanks for having me, Natasha. Appreciate it.
And you gave Tranq this designation as an emerging threat just this past week. It's the first time your office has used that label since creating the category in 2019. What is so urgent about Tranq? Why do you believe it rises to that level?
So, as you've described, it is a dangerous and deadly drug for people. It's been approved for veterinary medicine, but not for human beings. And when it is used, we have seen an increased amount of finding it on almost all 50 states. And then we've also seen increase in deaths associated with xylazine and fentanyl. To the extent of some areas in the country, we have over 1,100% increase in those deaths in the recent years. So this causes us to not only be concerned and troubled, but making sure that the nation knows about this. And we've put in place certain actions that we need to do in order to counteract this emerging threat and head it off where it needs to be.
You know, according to a recent DEA report, to your point, Tranq detected in roughly 800 drug deaths in 2020 in our country. And then in 2021, that figure shot up to more than 3,000 deaths. And I know here, you know, as a network, initially we were seeing it proliferate in places like Philadelphia, but this drug has now been identified in at least 48 out of 50 states. How has it cropped up now in so much of the drug supply in this country?
Well, Natasha, first of all, we know that the drug traffickers and producers are going to do everything they can to seek profits off of vulnerable Americans. And this is just a process and one of the part and parcel of that. What is important now that wasn't in the past is we are taking proactive steps. This is something that the administration from day one has been focused on to save lives. And while this drug is deadly and dangerous, you know, it is mixed with fentanyl, which makes this opioid crisis, especially with fentanyl, so much more lethal and so much more destructive. So we want to make sure that we are making people aware, but increasing testing, for instance, making sure that people have the resources to get the treatment and the protocols in place as early as possible so we could save more lives.
Yeah, and we're talking about treatment. I know, you know, here on the show, and NewsNation has spoken with groups on the ground in places like Philly who are doing their best to try to get ahead of this. And they've said that detox, that coming off of xylazine, is unique and terrible and wholly separate from coming off of fentanyl, and that there is not medical support or will there to help people who want to get off Tranq. What is your response to this? What needs to be done?
So you're exactly correct that the withdrawals from this drug are so difficult and dangerous. It's one of the worst ones I've seen in my 25 years of practice. On top of it, we really don't have any antidotes or specific treatment medication. So managing people with this, you know, makes fentanyl management look like walk in the park, unfortunately. So it's really important for us to make sure that we are developing those systems, because it is unfortunately not confined to metros like Philly. It's all over the country now. So we want to make sure that doctors and prescribers and ICU folks know across the nation how to manage these withdrawals.
I mean,
we also want to make sure.
Sorry, I'm sorry to interrupt, Dr. Gupta. I appreciate you describing as a doctor witnessing what withdrawals from Tranq look like. Can you help share with us, what does a withdrawal from Tranq look like?
Well, first of all, people are very afraid that they're going to go into this physical withdrawal, so they will go and seek medication. Secondly, what we will see is people oftentimes, they will have severe respiratory trouble. They will have severe anxiety, sweating, pain all over the body, and they will do what they need to do to prevent that. And then management includes making sure that we're monitoring the vitals, for example, the blood pressure, the heart rate, the breathing rate, because any one of those could be in jeopardy when we're talking about a person withdrawing from it.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.